Welcome and welcome back to Diamond Works Podcast. My name is Pierre Clark. This episode we're talking about what occurs when the temperature gets warmer. What's happening is that embarrassing feeling we have when we have these huge sweat stains on our garments, under the arms, but even the groin region. Not only that, when we perspire and it stays on the garments for way too long, especially your socks, you're gonna have stinky feet. So we want to take some of this embarrassment away, and the number one reason that people do Botox for the underarm sweating is not because it's convenient, but it's because number one, it is less embarrassing to not have any sweat stains, but also you're saving money on garments and purchasing new clothing every year. If you've ever had a huge dry cleaning bill, and sometimes those sweat stains do not come out. So Botox for the underarm sweating, palm sweating, and feet sweating is what we're going to look at today. We're going to see if it's viable, if it's something that we should do. So look at our first image here is this. This is the typical sweat stain under the sleeves. Now, if you have a problem sweating underarms, I guarantee you that this sweat stain many times becomes so much wider. When that's becoming wider, it means that you're overly producing perspiration unnecessarily. So it's not something that you actually need, because all over the skin you do perspire. You don't need all of it under your arm. So removing the sweat gland secretion is going to help save you the embarrassment, but also save you money on your clothing. So next one is, how do we figure out where we are going to inject? Well, there's something called a starch test. The starch test is there to help us figure out where these sweat glands are predominantly located. So that is called starch test. If you're ever going to have any treatment done under the arms or the palms or the soles of the feet for sweating, make sure that your injector, make sure that your provider is applying the starch test. The starch test tells us where exactly that sweat glands are and where we can inject those areas. And typically what it is, we divide the area, which I'm doing for this injector. I'm kind of doing their job for them. And once we divide the area, we can clearly inject in those spaces and have a uniform spread of the toxin within the region. Underarm sweating is one of those things where it actually lasts longer than 4 months. I've had patients that within the entire summer and some of the fall, they don't sweat anymore. And when it does return, or when the Botox effect goes away, they're still not sweating as much. So I believe that there's some memory to this overactive sweating, and when you train your body not to sweat as much, then you enjoy the longevity of the treatment. Palm sweating, this is very common. My mother suffered with palm sweating, and she would always walk around with a napkin in her hand. The problem with that is that if you have to shake someone's hand, it's really gross for the individual touching your wet hand, especially if they don't know you. So palm sweating is something that works really well. I'm going to be honest, it's very painful. However, regardless of whether it's painful or not, it's something that's going to really take away the embarrassment of having sweaty palms. Let's take a look at our next image here, which is the foot sweating. Now, bacteria will definitely feed on the microorganisms around the foot, and with the perspiration that's occurring, an odor is going to be released. If you're using heavy occlusive moisturizers on the feet, you're going to increase the sweating and increase the stinky feet. So number one, don't use moisturizer on the feet. Number two, get your Botox treatments under your feet for this to go away. Again, there's some type of glandular memory that's associated where individuals who are having hyper sweating of the feet after having subsequent Botox injections, they tend to sweat much less even after they've stopped the Botox injections. So this is a wonderful treatment for overactive sweating glands. How does botulinum toxin prevent sweating? Well, it's very simple. Botulinum toxin prevents the secretion of the perspiration by reducing the amount or stopping the amount of glandular squeezing. Right? So there's tiny little muscles surrounding glands, and when these muscles squeeze, it pushes liquid out. That is perspiration. Botox stops that from happening. And so if it doesn't happen, then you're not sweating. And remember, you don't need the sweat glands under the arms and the palms and the soles of the feet. You sweat all over your body anyway. That's it for overactive sweating and Botox treatments. I hope this was helpful information to you. Make sure you find a provider that, one, does a starch test to get all of those sweat glands, and that you don't use heavy moisturizer on your feet or your hands, which will eliminate the amount of sweating that you're having anyway. Don't forget to subscribe. We always have more than enough information for you in this channel.